For those of us that have more gray hair and have seen the evolution, I think that you see a lot happier people at the very least. The quality of life is significantly improved in these individuals. I mean, people that would wear long sleeve shirts in July during humid weather because they don't want to expose the plaques on their arms because they're embarrassed, women that would never wear a black dress because of the flaking that would occur, people that would never go into a hot tub, people would never take their grandchildren to a swimming pool, that's changed. I mean, their quality of life is significantly improved. Now, they still have some anxiety that their psoriasis could come back, but you know, by and large, if you can get psoriasis down to 1–2% of their body, people are pretty happy, and you know, I think they're some of the most fulfilling patients that I take care of today. Unfortunately, even those physicians that don't know about tar and light, psoriasis is really undertreated. There's a severe undertreatment of people with moderate to severe psoriasis. Only about 20% of people with moderate to severe psoriasis are adequately, appropriately treated. Many dermatologists have avoided or shunted away from the treatment of moderate to severe psoriasis. Many like doing other things in their office. So I think there is, unfortunately, an undereducation of the treatment of moderate to severe psoriasis in many of the residency programs that exist right now. And if you do look at the studies, about 60% of people with moderate to severe psoriasis are very unsatisfied with the treatment that they're getting. And most people with psoriasis usually see 3 to 4 dermatologists before they get to the right dermatologist that treats them appropriately, leaving many of them hanging in the balance and saying, you know, I'm frustrated, I'm not going to do anything. I think that the problem is, there's a couple of problems. One problem is what happens between 6:58 p.m. and 7 p.m. Eastern Standard Time every night on TV, somewhere between the end of World News and Jeopardy. And what you have are about 3 commercials that all start out with, "I have terrible psoriasis." And I agree, their life is impaired. They're not going to, many of them have the opportunities that other people have because of the depression associated with it. And then they go on this medication and they're feeling great. But the end of the commercial says, oh, but you're going to die from malignancy, lymphoma, tuberculosis, or a serious infection. And in truth, if you look at the data, that is not true if you use biologic agents as a monotherapy. If you start adding on other medications with it, you do start increasing risks. But as a monotherapy, it's not that bad. So many dermatologists will say, oh, I don't want to take on that risk. I don't know how to monitor. I don't want to take the extra step to go through a specialty pharmacy to get a medication improved because that takes away time from my medical staff and that costs money, which is true. That is all real. I mean, if it's just writing a script and somebody, or an email script, and going to the pharmacy and they picking up their, you know, doxycycline, then that's one thing. But when you have to fill out forms and submit it to a specialty pharmacy and coordinate with the patient and bring the patient back, I mean, you have to be interested in doing that. And it has to, in some docs, they really rather do procedures. They'd rather do cosmetics. I think some people believe that it takes longer to take care of a psoriasis patient than it does a cosmetic. I don't think that's true. I think that even a really tough psoriatic, if you really can focus on what's going on, in 10–12 minutes, you can figure out what's going on, discuss all the options, figure out where you want to go, and get your blood work. Once you get that checked out, you can then submit, and it's not as difficult as people think. It's difficult. I think most of my patients right now find me through the internet. I think the National Psoriasis Foundation is a valuable resource. If people go to the National Psoriasis Foundation, there's a list of physicians that specialize in the treatment of psoriasis. I think you're not going to find it necessarily from dermatologists that don't take care of psoriasis. I get, like, within 15 miles of me, hardly any referrals. From 40 miles away, I get lots of referrals. So, and it's not like from primary care. It's basically either word of mouth, internet, search engine optimization, and that's how people find out. And it's just like going to the wrong store and not finding what you want. And you basically, I mean, I've had people that bounced around for many times, for many years, that were just giving topical therapy, which is pretty much a crime in a sense, because as we learn more about psoriasis being a cutaneous manifestation of a systemic disease, when you adequately treat the cutaneous manifestations, you diminish many of the cardiovascular and inflammatory components that occur internally. And that can't be done just by topical therapy, and probably not by phototherapy. You need to have a more aggressive approach.